If this was your granny, if this was your child, if this was your husband, wife, brother, sister, do you think the service they're getting suits purpose? And, you know, shamefully it didn't.
What we wanted to do was respond to the needs of our patients, and to respond to the needs of our patients we had to work differently.
Actually, there is a need to deliver the service across the whole week. I think when you see the evidence on mortality, morbidity, with weekend admissions, you, as a health profession, you can't but need to extend your service.
Why do we accept that we don't give the same care on a Saturday and a Sunday as we do on a Monday to Friday?
And we need to be doing everything we can to make sure that we can flow patients as quickly as we can through our hospital. And we need to do that 7 days a week. We can't switch off on Saturday and Sunday because otherwise the hospital clogs up and we cease to function.
I can tell you how difficult it is to move patients through the different departments once it gets to 6 o'clock. Whereas that's not true now. Those services are still working. And they're working towards they're not just picking up sick patients, they're picking up patients that they know are going home tomorrow. But actually, if they just had that blood test, if they just had one more x-ray, if they just had one more dose of, then actually those patients can get that. And then when the teams come in the next morning, they're ready to go. So we can discharge them earlier. So the acute medical unit get the beds downstream earlier, which means the emergency department get into medicine earlier.
In terms of flow, we've seen an impact on that. Patient care in terms of morbidity and mortality has been better as well.
Those consultants were so productive during those 6 hours. They were uninterrupted on a Saturday. They had no clinical queries, no telephone calls, and the impact, the volume of work that they got through was probably at least as great, if not greater, than doing the same amount of work on a Monday to Friday.
If a person's been discharged from the hospital on a Saturday or on a Monday we might need to provide an ambulance service to take that person home. On a Saturday, the son or daughter might be able to pick them up, and that's a lot better for the patient.
I've got a lot of members of staff who have children or have very busy home lives with children, kids off at uni, etc. And they're actually happier to work at the weekend because childcare arrangements are already in place with a significant other.
They've really been able to come up with lots of ideas for sort of more quality improvement as well, because they've been around at weekends and see how things do run completely differently. So they'll say, you know, this isn't working, could we look at this, could we do this for budget setting? And nurse practitioners really come up with some good ideas, which we never would have had if they hadn't been there observing. Really.
They used to come in after a weekend, the radiologist, and find masses of reporting to do. They probably told you. If you actually work through the weekend, because you're in most of the time anyway looking at emergencies, guess what? Monday's better for everybody. I think it's what are you trying to achieve by 7 days? Instead of we're trying to achieve 7 days, what are you actually trying to achieve by 7 days? Which is consistency, good consistency through the week.